So this patient previously had a BBL, and that was fat transferred to the buttock. And according to the patient, they put in 1,400 cc's into each buttock, not together, but into each buttock. That is a lot of volume. And then also post-operatively, she mentioned that the garment that she was wearing was open and kept cutting into this area. So you can see in this area, there's a little bit of an indentation that the garment left, and she really does not like her buttock results. It's basically too much. And then you can see also from the sides, what we're dealing with is the excess fat in this region. And what we want to do is we want to do liposuction in there. And again, of course, liposuction all across the buttock and to smooth all this out. And then you can see from the front, what we want to do is again, round out those sides. You can see that this is pointy and this is pointy, and we want to basically smooth those out to make those nice and even. And then also we want to do some liposuction on the inner thigh in here to eradicate some of the excess fat deposits in there. So we're going to be doing liposuction all throughout the medial thigh. And then also we're going to be liposuctioning the Mons region of the pubic region there to get her a flat tummy. So let's go to the operating room and I'll show you how we do liposuction of the Mons or the pubic region, the bilateral medial thighs, the bilateral hips, and the bilateral buttocks. So we're doing liposuction of the buttock. This BBL, buttock augmentation fat transfer, is way too big. They put way too much fat in here. Doesn't fit her body at all. She's not happy, disproportionate. So we're basically reducing the size of the buttock. We're undoing a BBL. So I'm doing liposuction, removing all that, not all, but most of that transplanted fat. So we've sucked out about 3,500 cc's from the buttocks, about 1,700 from each side. We have a much more proportional buttock. We reduced a lot of the transplanted fat. I think a much more acceptable buttock for her shape and size and everything. Now we're going to flip her over, do the hips, inner thighs, and the pubic, the Mons region. We're doing liposuction of the hips here. You can see, look at that, that's way too much for her.
What are your main concerns when performing lipo?
Many concerns. One, you don't want to take out too much fat. Two, you don't want to leave too much fat behind. Three, you don't want to take out so much fat in one area that you have skin rippling and dimpling. Four, you don't want to kill the skin. You don't want to cause too much bleeding. Those are the main concerns. You got to worry about the anatomy, the blood vessels, the nerves underneath. And then women collect fat in here. It's very difficult to lose fat in here. I always get annoyed by the people telling my patients, oh, just lose weight here, just exercise. What exercise are you going to do to get rid of this fat? No, exactly. So it's very difficult to lose fat in this area. Diet is important, of course, but the best way to get rid of the fat in this area is liposuction. Here we are, here we're doing it.
una loca. Me tiene loco en la cabeza cuando me tocas. Siento que todo está bien, pero en verdad yo no sé si tú lo sientes también. Entonces.
So we're done here with the liposuction of the buttock to reduce the size of the buttock, to reverse the BBL, if you will. Do some liposuction on the hips to give her more proportional anterior posterior view. Liposuction of the pubic region, Mons region, liposuction of the medial pelvis. I think she looks excellent. Much better body proportions for her height and her weight, and I think she has an excellent result. So we're going to get her in a garment now. She's going to be swollen for probably about a good 2 to 3 weeks. She's going to wear the garment for about 6 weeks, and then do lymphatic massage in about 2 weeks. So this is how we do liposuction of the pubic region, inner thighs, outer thighs, hips region, and a reduction of the BBL that had previously been done, in my opinion, too big. Thanks for watching. Please subscribe. We'll see you next time.